my name's Brandy. I'm going to be your nurse today. How you doing?
I'm doing good.
Good. Can I have you verify your name and date of birth for me?
Carolyn Bailey, October 2nd, 1991.
Okay, and do you know where you're at?
I'm in your living room.
And do you know what day of the week it is?
It's Saturday.
Okay, so patient is ANO times 4. Speech and effect is appropriate, and appearance is well groomed. So I'm going to go ahead and just do a kind of skin general assessment. Okay, skin is pink, warm, dry, and intact. So I'm going to look at your hand. So no clubbing noted in fingernails, and cap refill is less than 3 seconds in all 10 digits, which means your circulation's good. Skin turgor is brisk, so you're well hydrated. So next what I'm going to do is just kind of massage your head basically, but I'm just checking for any lumps or lesions. So normal cephalic head, no lumps, bumps, or lesions. Hair distribution is adequate for age and ethnicity and gender. I'm going to look at your eyebrows. Eyebrows are also well. If you feel pain, I'm going to go ahead and just kind of percuss your forehead. So this is the frontal maxillary. Any pain?
No.
Okay. So what we're going to do next is we're going to test cranial 5. So I'm going to have you close your eyes and point to where you feel anything, okay? Okay. And then you can open, and then I'm going to have you open your jaw and close and move side to side. So cranial nerve 5 is intact. Next, I'm just going to look at your lymph system. If you feel any pain or pressure or tenderness, just let me know. So this is preocular, postocular, occipital, tonsillar, submandibular, submantle, anterior cervical, posterior cervical, supraclavicular, and then we have infraclavicular. Any pain with that?
No.
Okay, so next I'm going to just listen on your neck. Might be a little cold. Okay, that is within normal limits. That's good. Go ahead and just set this down. So next I'm going to have you just kind of lift your neck up. I'm just looking at your trachea, and it's midline. Go ahead and bring it back and just relax. And then swallow. Look to the right. And then look to the left. So thyroid is adequate, no bumps, lumps, or pain. With that, so next what I'm going to have you do is I'm going to have you do ear to shoulder, and then chin to chest, and back, and then shrug your shoulders. And now we're going to do it against resistance, so I'm going to have you, okay. So range of motion is within normal limits, and cranial nerve 11 is intact. So next I'm going to have you just smile for me, frown, raise your eyebrows, and then close your eyes. Cranial nerve 7 is intact. So next we're going to go ahead and move on to your eye exam. Patient previously did Snellen chart and passed. So I'm going to have you just focus here, and then follow with just your eyes. Okay, and then just focus on it. Okay, so next I'm going to shine the light in your eyes, so I'm going to have you go ahead and close, and then open. Okay, close, open. Perfect. One more thing. So I'm going to have you just look straight ahead, keep both eyes open, but just place that over one, and then go ahead and remove. Okay, so cranial nerves 2, 3, 4, 6 are intact, and pupils are equal, round, reactive to light, and accommodation is noted. Next, we are going to go ahead and look at her ears. Okay, so I'm just getting this ready. So I'm just going to look at, so they are adequately placed, they are symmetrical, so the helix, tragus, and lobes are intact, no bumps or lesions. Do you have any pain when I do that?
No.
Okay. So next I'm going to go ahead and just look in your ears. So membrane is opaque, shiny and intact. And I'm gonna just look at this one as well. Get your hair out of the way, maybe.
Maybe it's a little unruly.
That's okay. So once again, opaque, shiny, and intact. And Umba, Paris tinnitus, and Paris flactia are noted. And cone of light is present in both ears. So next what we're going to do is we're going to go ahead and do a whisper test.
Okay.
So I'm going to whisper 2 words in each ear, and I just want you to repeat them.
Okay. White shirt. White sock.
Okay. So next thing we're going to do is we're going to test your inner ear and your balance. So I'm going to have you go ahead and stand up. What you're going to do is just lift one leg off and do like a squat. And then do the other leg. Perfect. Do you have any trouble with balance at all? Any vertigo? Okay. No. So it looks like your inner ears are good and your balance as well.
Yeah.
So next, moving on from that, we're going to go ahead and do your nose. So let me just prep this. Okay, so your nose looks symmetrical. Any hard time breathing or anything with that? Okay. So I'm going to go ahead and just look in your nose. Okay. All right, inferior and middle turbinates are noted and intact. Everything looked good in there. So next what we're going to have you do is I'm going to go ahead and have you close your eyes and plug one side of your nose, and then I'm going to have you smell and tell me the smell.
Lemon.
All right. So your cranial nerve 1 is intact.
Good.
With that. So we're almost done. We're getting close. Next, I'm just going to do your mouth. So lips are symmetrical, no lesions or sores. They look moist and pink. So I'm going to go ahead and have you just stick your tongue out, move it side to side, and then up and down. So cranial nerve 12 is intact. So I'm going to go ahead and just look in your mouth. So mucous membranes are pink and moist, so that looks good. So last, a little bit of annoying thing. So I'm going to have you go ahead and open and then say ah. All right, cranial nerves 9 and 10 are intact and tonsils are 1+. Do you have any questions for me at all? That was all I needed to do.
Nope, I'm good.
Okay, thank you very much.
Thank you.